ladies and gentlemen, please join me in welcoming the Honourable Deb Matthews, Minister of Health and Long-Term Care. Minister.
Well, thank you so much, Gisèle, for your kind introduction, and thank you to the Toronto Board of Trade for hosting me today. You know, I gather that this speech is getting a fair bit of attention. In fact, this morning I was leaving my apartment to go down to Mount Sinai for breakfast with the chiefs, and the fellow at the front desk on the way out said, "Good luck with your speech today." So people are paying attention, and I want to say thank you for being here. This is a topic that really is worthy of our attention. I want to say thank you to so many dedicated healthcare professionals who are with us today. I want to say thank you for the work you do every day, and thank you for helping me understand the challenges and the opportunities in healthcare. Our goal is to make Ontario the healthiest place in North America to grow up and grow old. And we're going to achieve that goal by making sure that families get the best health care they need when and where they need it. Regardless of the challenges we face, we are going to make Ontario's healthcare system better for patients today so that it's there for patients tomorrow. There are two big challenges that we need to face head-on. The first challenge is fiscal. We have a budget deficit that demands we deliver healthcare services more efficiently. The fact is we have a $16 billion budget shortfall, and healthcare is 42% of that budget. The second challenge is demographic. We have a growing population, an aging population, and that puts pressure on our healthcare system. So we have a choice to make. We can continue down the road of the status quo and end up with a healthcare system that simply can't meet patients' needs, or we can choose the road of healthcare transformation and have the courage to implement the changes we all know need to be made. Our parents' and grandparents' generation had the courage and they had the compassion to create our uniquely Canadian universal healthcare system. And now it's our turn to protect and strengthen healthcare so it's there for our children and for our grandchildren, just as it is here for us. Since I became Minister of Health, I've listened very, very carefully to your advice on how we can make healthcare better. I've listened to frontline staff, I've listened to administrators, but most importantly, I've listened to patients. I've listened to their mothers and their fathers, their children, their wives and their husbands. And I can tell you that there is a strong consensus in Ontario about what needs to be done. And now it's time to act. So today I'm here to talk to you about how we're putting your advice into action with our plan to transform healthcare. Our action plan builds on the progress we've made over the last 8 years. So let's start by looking at how far we've come by working together. We started with access to care. Today there are more than 3,000 more doctors, 12,000 more nurses, over 1,000 more nurse practitioners than there were in 2003. We've reversed the brain drain, and last year we licensed a record number of doctors. We've cut key surgical wait times in half, and over 7 million Ontarians now have electronic medical records compared to only a handful 8 years ago. We then turned our attention to quality, so we passed the Excellent Care for All Act, and hospitals now publish quality improvement plans. Compensation of senior executives is tied to achieving the goals in those plans. We created Health Quality Ontario to support quality improvement in patient care using the best evidence on the best clinical practices from the world's best researchers. And we're improving value for money. Value means getting the highest quality care at the lowest cost. It also means not spending on things that don't improve patient outcomes and spending more on things that do. We are determined to keep making changes that give us better care for patients and better value for taxpayers. Take vitamin D testing, for example. Now, no matter what Dr. Oz says, the best available clinical evidence shows that vitamin D testing in otherwise healthy people doesn't improve outcomes. So by deciding not to find vitamin D tests for the general population, we were able to reinvest nearly $70 million this year in care that does improve outcomes. We created LHINs, local health integration networks, and they have begun to break those silos down for patients. They've helped to balance hospital budgets. They've improved the accountability of providers. We eliminated professional allowances paid by generic drug companies so we could cut generic drug prices in half. This not only benefited Ontario, but resulted in lower drug prices across Canada. Our drug reforms are saving $500 million a year. And I'm very happy to tell you that we've realized an additional $100 million in drug savings this year. And I think there's more we can do. Now, for all the progress we've made, we still have a long way to go. 1/4 of healthcare spending is on avoidable conditions like heart disease and type 2 diabetes. And while the number of smokers in Ontario has dropped from 25% of the population to 19%, from 25 to 19 in the last 10 years, smoking-related illness remains the #1 cause of preventable death in Ontario and costs the system almost $2 billion every year. There are still too many patients relying on emergency rooms instead of family care providers. We have far too many alternate level of care, or ALC, patients in hospital beds when they would get better care at a lower cost at home or in long-term care. Too many people are having trouble navigating the system. They're receiving uncoordinated care from a number of providers. We still have far too many people being readmitted into hospital within days of leaving. And there's still too much unnecessary administrative overhead in our healthcare system. So while we have achieved real and measurable improvements, we still have big changes to make. The Premier and I are of one mind. We are determined to do what needs to be done to keep improving the quality of healthcare and access to it. And we know we can't keep spending our health care dollars the way we do now. We have to get smarter about how we spend. That's because we face some significant challenges, fiscal and demographic. These challenges are inescapable and they demand action. We live in a new fiscal reality. Tough economic times have hit our finances hard. We've set clear targets to get back on track. We are determined to balance our budget by 2017, and we all need to do our part. I want families to know that our healthcare system is well funded. Indeed, we're now spending 61% more on healthcare than we did in 2003. And I want families to know that healthcare spending will continue to grow. We are not cutting health spending, but the fiscal challenge demands that the rate of increase will slow significantly. That means we have to shift spending to where we get the highest value for patients. And healthcare is overflowing with opportunities for reform. There's another reason why we have to change how we spend our healthcare dollars. Some of you may know that I'm a demographer by training, and I find population pyramids fascinating. Like the rings of a tree, they reflect our history, and they also project our future. And what I see in this population pyramid keeps me awake at night. We are going to have 43% more seniors a decade from now, and twice as many 20 years from now. And that's a good thing. I want to be one of them. And the increase of our elderly will grow even more quickly. Every year, the number of seniors aged 90 and older is increasing by 10,000 people. And that's a good thing too, because I want my parents to be two of them. And of course, as people age, they need more health care. Now, this graph shows how much we spend by age group today. And here's what we would spend 20 years from now if we make no changes to the way we care for our seniors. If we continue doing what we do today, caring for the increased number of seniors would cost $24 billion more by 2030. That's a 50% more than today, and that doesn't include inflation. The fact is, our healthcare system is struggling to meet the needs of our seniors today. We owe it to them to do better. Now, here's what we spend on healthcare: $47.1 billion. Now, as we were preparing this, somebody suggested we just make it $47 billion. I said, you know, that 1.1 is $100 million. So let's put it in there. $47.1 billion. And I can't tell you how many times I've heard people say that there's enough money in the system. The problem isn't that we're not spending enough, it's that we're not spending it on the right things. So here's how we spend it: 35% on hospitals, 23% on physician compensation, 8% on drugs, 8% on long-term care, 6% on community care. That other wedge is mental health, public health, and so much more. Now, there is a pretty strong consensus that we do not have this balance right, that we need to put more into community care to help our growing number of seniors. The demographic pressures demand it. Indeed, by not having adequate resources in the community, we're spending more than we need to in other parts of the system. We need to build the continuum of care in the community so that there are more options for seniors to get the care they need outside of hospital and outside of long-term care. So, if we're going to strengthen community care, something else has to give. We need to make trade-offs, and that's what we wrestle with throughout the budget process. Let me give you an example of a trade-off. A 1% increase in physician compensation could buy home care for 30,000 seniors. A 1% increase in hospital budgets could buy 5 million more hours of home care. So if we have more seniors to care for, and if fiscal pressures demand we keep costs down, then we have to address physician compensation, because every precious new dollar we put into the system must benefit the health of patients, first, last, and always. Our action plan to transform healthcare is obsessively patient-centered and will invest healthcare dollars where patients need them most. For all of the challenges we face, we have tremendous opportunities, aided by wonderful innovation and technology, a commitment to implementing the best evidence, and most importantly, we have a system ready, indeed eager, for change. Because people who work in healthcare know that we can do much, much better for patients. What we need to do is work better together. I know that if we capitalize on these opportunities, we can and we will overcome the challenges we face and end up with better care at lower cost. So here's our action plan. We start by keeping Ontario healthy because we all want better health, not just better health care. Helping people stay healthy requires partnership. Government cannot do it alone, but we can help. That's why we're promoting healthy living and supporting better management of chronic diseases. And to succeed, we need people to participate in their own wellness, in part by taking advantage of screening and vaccination programs. Childhood obesity rates have skyrocketed. We know that obesity leads to diabetes and heart disease. Unchecked, these chronic conditions can be fatal. Well, we're not going to just sit back and let that happen, not with our kids. So we'll create a council on childhood obesity. Its goal will be to reduce the childhood obesity rate by 20% in 5 years. It's an ambitious goal, but it reflects the urgency of this situation. We'll continue to drive our Smoke-Free Ontario strategy. We're now funding smoking cessation drugs and recently expanded nicotine replacement therapy to those in treatment for addictions. Keeping Ontario healthy is also about detecting disease early. That's why we will step up our cancer screening efforts, including online personalized cancer risk profiles. This tool will use patients' medical and family history to measure their risk of cancer and then match people to screening programs and prevention supports, including genetic testing for people at high risk. The second priority in our action plan is providing patients with faster access to stronger family health care. Family health care should be the hub of patient-centered care. That means they should play an even stronger role in the healthcare system. I'm very pleased to announce that we're going to improve transitions in healthcare by bringing planning for primary care under the umbrella of the LHINs. LHINs are the air traffic controllers of our healthcare system, and when they can plan primary care in a community, they will improve access and save money. It will make it easier for your doctor, your family doctor, to play the coordinating role between different healthcare providers, both inside and outside of hospitals and long-term care. No one knows better than family doctors what the problems are in our healthcare system. It's time to bring their voice to the table so they can be part of finding local solutions. It will also bring more accountability for delivering better care for better value. Now, everyone who wants a family care provider should have one, but just having one isn't good enough. You need to be able to access your family care provider when you need them. That means more after-hours care, more same-day or next-day appointments. We're going to support the efforts of family doctors to improve patient care by giving them quality improvement tools similar to those now in our hospitals. And we'll improve primary care with evidence-based advice from Health Quality Ontario. Imagine how much stronger family health care can help an elderly person with complex needs. By organizing care at home with house calls from their family doctor, along with other providers and community supports, we'll reduce their likelihood of admission to hospital and delay or even prevent a move into long-term care. That's much better care at a lower cost. Which leads me to the third priority in our action plan, making sure patients have access to the right care at the right time in the right place. Access to the right care means ensuring that patients get the care they need based on the best available evidence. We're going to accelerate our evidence-based approach to patient care. We will strengthen Health Quality Ontario so that we increasingly shift funding to services that are known to get the best results for patients. This year alone, evidence-based changes have allowed us to reinvest $125 million toward more effective patient care. Likewise, we'll continue to fund drugs only when the best clinical evidence tells us they benefit patients. More access to the right care will also require healthcare providers to work to their full scope of practice. It means a bigger role for nurses, nurse practitioners, dietitians, pharmacists, midwives, to name a few. We will ensure that patients get access to care at the right time, with early interventions that are clinically shown to improve health and save health dollars in the long run. Nowhere is early intervention more important than in mental health. 70% of mental health problems first appear in childhood and adolescence. That's why we're bringing a new focus to children's mental health. We're also stepping up management of chronic diseases like diabetes. By acting earlier to manage chronic conditions, we can often prevent the worst effects of the disease. We will continue to drive our wait time strategy so that patients can be assured of medically appropriate waits for the procedures they need. Less waiting time means fewer complications and more time being healthy. And families need access to care in the right place. For our seniors, the right place to receive care whenever possible is at home, in their community, in their neighborhood. We will launch a new senior strategy to help keep seniors healthy, provide better quality at home where our seniors want to be with neighbors and family. As part of this strategy, we will create new care coordinators to respond to the needs of our seniors with the most complex conditions, particularly in the transition from hospital to home. These care coordinators will help coordinate the care between specialists and family doctors, hospitals and their community, and ultimately cut down on readmissions while at the same time improving care. We'll fund 3 million more hours of personal support worker care to help our seniors with their daily needs. And to recognize the vital role that family members play in healthcare, we've already introduced legislation to make it easier for them to care for loved ones by providing up to 8 weeks of family caregiver leave. Our plan includes another important step forward. We will take pressure off our hospitals by moving more routine procedures into specialized, not-for-profit clinics, but only if they provide better care at a lower cost. This move will free up hospital operating rooms to do more procedures that do need to be done in a hospital. Last week, I visited the Kensington Eye Institute, which has become renowned for high-quality cataract procedures funded through OHIP. By focusing on a few select procedures, they can serve more patients more quickly with excellent patient outcomes. We need to do more of this, and we will. Our funding models need to be updated to reflect our plan to transform patient care. We will accelerate the transition from provider-centered funding models towards a patient-centered funding model where funding is based on the services provided. You see, today, a hospital may choose to cut services in order to balance their budget. In the future, more patients being served with medically necessary procedures will actually increase the budget of a hospital. Of course, we will continue to recognize and support the unique needs of our small hospitals in our smaller communities. As we integrate the full patient journey into local planning, funding will follow the patient throughout the system, from primary care into hospitals, into specialized clinics, into long-term care, and into home care. This will create the right incentives for better care at every stage of our healthcare system and deliver better value for healthcare dollars. The simple truth is we can't continue increasing healthcare spending at the rate we have done to date. This, coupled with the current state of our provincial deficit and Ontario's aging population, means we need to make immediate reforms to protect universal health care. This action plan will get us there, and to achieve our goals, we need the support of the entire system. Part of that is a culture shift towards transparency and accountability. In tomorrow's healthcare system, there is no room for self-interest, only the best interest of patients. I will be held accountable for our success or our failure, and I commit to reporting back to you 1 year from now on our progress. However, from patients to doctors, frontline nurses to hospital administrators, personal support workers to those working in LHINs, we all have a role to play in this healthcare transformation. This is a call to action. We need to make changes. So healthcare is in great shape for us as we get older and for our kids and grandkids throughout their lives too. So here's the good news. We know what we need to do. We have a great plan to transform healthcare. Across the province, these changes are already starting to take shape. To those of you who are at the forefront of this transformation, I say thank you. You have inspired us all. You have given us the confidence to know that Ontario can be the best place to grow up and grow old. Change will not happen overnight, and it will not always be easy. The reality is we can't afford to wait. We must be relentless in our pursuit to meet this challenge. Patients are counting on us, and I have every confidence that we will get there together. Thank you.